Thank you and good afternoon. Today we're reporting on three periods. From Friday to Saturday, we had 443 new cases of COVID-19 diagnosed in the province. Saturday to Sunday, an additional 493 people were diagnosed with COVID-19, and in the last 24 hours, an additional 424 new cases. Our total for the weekend is 1,360 people newly diagnosed with COVID-19, bringing the total number of people in British Columbia to 139,664. Of the new cases this weekend, 291 were people in the Vancouver Coastal Health Region, 861 were people who live in the Fraser Health Region, 36 people live in the Vancouver Island Health Region, 126 in the Interior Health Region, and 47 people live in the Northern Health Region. We currently have 5,021 active cases across the province, of whom 350 people are in hospital right now, 132 of whom are in critical care or ICU. And we have 132,841 people who have recovered from their acute illness with COVID-19. There are no new outbreaks to report in the province today, which leaves us with 3 active outbreaks in long-term care, assisted living or independent living, and 2 in acute care units. Sadly, this past weekend we've had additional deaths. 14 people in British Columbia have died from COVID-19, bringing the total number of people who have died from this virus to 1,648. Of the people who passed away this past weekend, 12 were people 60 or older, 4 each in the 60 to 69 year age group, 4 in the 70 to 79 year, and 4 were in the 80 to 89 year old. In addition, we had 1 person in their 40s and 1 person in their 50s. And this reminds us that this virus, while differentially affecting the seniors and elders in our lives, also can have severe effects on young people, including people in their 40s and 50s and younger. And our condolences and our thoughts are with the family members, with the caregivers, the people who knew and loved all of those who died this past weekend. So far here in British Columbia, we've delivered 28,398 doses as of yesterday of all 3 COVID-19 vaccines. And this means over 55% of eligible adults 18 years and over have now received their first dose of vaccine in British Columbia. We've also given 130,023 second doses, which is about 3%, but we know that many people will be coming due in the next few weeks with their dose 2. Everyone in BC now who is 18 years of age or older can register and book your appointment. It is now your turn, all of our turn, and I encourage everyone to get immunized as soon as you can. The data we shared last week reminds us that it takes as long as 3 weeks or longer to have the full protection from these vaccine doses. So the sooner you register and book your appointment and get your vaccine, the sooner you will have the protection that we are all looking for from this dose. Later on this week, I anticipate we'll be able to share more details about vaccine availability for youth, 12 to 17 as well. I do want to take a minute to talk about the second dose for people who in British Columbia who've received the AstraZeneca vaccine since we had our first shipment in about mid-March. We know that this vaccine, from the clinical trials and from the evidence that we've seen in other places, including the UK and here, that the protection that you get after dose 1 with this vaccine goes up over a period of as long as 12 weeks. And we know that even a delay for up to 12 weeks means that you get better protection from the vaccine, and that is the way that our immune system develops both our antibody protection and the cell-mediated protection over time. The remaining stock that we have of AstraZeneca here in BC, and we have kept somewhere in the vicinity of about 20,000 doses, is good until the end of June. So it does not expire. We know that there's been reports, and some of the lots that were received in Canada and some other provinces expires at the end of May. We have used up all of the AstraZeneca that we received that expired early on in May, and we now have vaccine ready and waiting for people for their dose 2, that we have some time before you're due for that, and we know that your immune system is well primed, and time because the vaccine is, the expiry date is not until the end of June. So for all of those who have received their first dose, you will have the option of receiving your second dose of AstraZeneca. And I know that's very important for many people. They chose to receive AstraZeneca because of the way the vaccine is produced and the effectiveness that we've seen from this important vaccine in other places. But we will have more information as well in the next few weeks to give everybody all of the information they need to make an informed choice about what you wish to receive for your second dose if you received AstraZeneca. And I say in the next 2 weeks, by the first week of June, we expect to have all of the results in from the immunogenicity studies that were done in the UK and other places to understand if there is the same or better protection from receiving the AstraZeneca first and then a Pfizer vaccine second. So I ask people to be patient. We know that we have some time as your immune system is developing its protective response to your first dose. You will have the options of receiving the second dose of AstraZeneca, and we have stocks coming in to be able to support that. Or you can take the information once we have it and make your own decision about what you want for your second dose. So I just want to reassure people that we have not forgotten, and we will be providing the information as soon as we get it to help you make those decisions. I know as well that for many people this May long weekend is often the unofficial kickoff to summer. And I know that we are all looking forward to this summer being different. But we are not yet ready to make any changes to our current provincial health orders this week. This means this long weekend it is important for all of us to stay the course. That means staying local, staying small, and remembering to use all of our protective measures, even as more and more of us are immunized and we pass that critical period of time that our immune system is ramping up to protect us. As well, we now have 400 to 500 people a day that are still testing positive for COVID-19. And that reminds us that the virus continues to circulate. And we have to do all we can to stop those transmissions as we're all developing this protection. That's why we can't be making any changes right now. We can't be traveling, and we can't be having large gatherings this weekend. But after this, we will be able to move on and move ahead. And we will be reviewing the number of people vaccinated, the peak at 3-week effectiveness, as well as the level of community transmission over the next few days to determine where we can go from here. And there is a plan that we will be presenting to you. Until then, we all need to hold the line. What you do today determines where we will all be 2 to 3 weeks from now. And that's why everything that we're doing right now is going to make a difference for our summer. I don't think anybody wants to see a surge in cases in 2 weeks. That would just set us back again, and we don't need to do that. We need to keep moving forward. We know that now over 55% of people 18 and over in this province are immunized, and their protection levels are going up as more and more of us are getting started on that path. So we need to continue to hold the line right now and continue to support each other to get through these next few weeks, to be kind to each other, to be calm, and to stay safe. Thank you.